Do this right now. Stand slowly. Just once. Now pay attention to your head, ankles, and legs. Do you feel lightheaded, heavy, or weak? And if that feeling returns after your blood pressure pill, that is the part I want you to notice. A 72-year-old woman in Phoenix kept a pill organizer on her kitchen table. She had taken amlodipine for years. Her numbers looked beautiful. Her doctor smiled. But by noon, she felt unsteady, and by evening, her ankles looked tight. She told her daughter, "I guess this is just what happens after 70. It crept in quietly. Here is what I need you to hear. Dizziness, swelling, cough, brain fog, and weakness are not random. They are not your age catching up with you. And they are not always solved by water, new shoes, or another birthday. Your body does not lose steadiness for no reason. And the most surprising part is this. The real trigger may not be in your ankles, throat, or brain. You may feel the symptom here, but the signal may come from blood pressure, potassium, kidney filtering, medication timing, or a dose that no longer fits. In my 25 years working with older adults, I have seen this pattern misunderstood repeatedly. Amlodipine, Losartan, and Lisinopril are not bad drugs. These medicines save lives. Do not stop them on your own. The danger is side effects mislabeled as aging. Today, I want to help you read that pattern. And we have science behind this. The NIH-supported SPRINT research group studied 9,361 adults over 50 with high blood pressure. Intensive treatment lowered heart events, but events involving low blood pressure, fainting, electrolytes, and acute kidney injury rose. In simple terms, better numbers need better monitoring. Because many viewers commented after our previous blood pressure medication video, today I will give you 5 values. What to track, what labs to ask for, what standing reading clinics miss, which symptoms deserve review, and what questions to bring next. But I am not going to reveal the most important connection yet. My name is Dr. Thomas Bennett. At Senior Health Daily, my promise is simple. Calm doctor, led guidance, plain language, real research, and practical steps older adults can discuss with their own doctor. Before we go any further, drop a comment below and tell me this. Is your symptom worst after your pill, when you stand, or by evening? Because your answer tells me which part of the medication pattern deserves review first. Write pill, stand, or evening in the comments. I read every single one. Now, important point before we begin. Lowering blood pressure itself is not your enemy. It protects the heart, brain, and kidneys. Problems begin when the dose is too strong, the body clears medicine slowly, or the seated number hides a standing drop. After 60, that mismatch can turn treatment into daily fatigue. So listen, because the first cause is one many people miss. Number 5 is visible, number 3 fools millions, and number 1 deserves attention. Keep the controlled number trap in mind, because the chart is the success, while the body is where the warning shows up. Now let us build the checklist around the body, not just the bottle. A blood pressure medicine is designed to relax blood vessels, reduce pressure, and protect the brain, heart, and kidneys. That is good medicine. But after 60, the same body has slower balance reflexes, less thirst signal, more kidney sensitivity, and often 3 or 4 other prescriptions sitting beside it. The arteries are stiffer, the kidneys filter with less reserve, and the nervous system takes longer to correct a sudden position change. So the question is not, is this pill bad? The question is this dose, timing, target, and monitoring still right for this person? A symptom that changes how you walk, sleep, think, or live deserves a medication conversation. Side effect number 6 is the one that steals confidence first. Dizziness when standing. Harold, 78, from Tampa, stopped walking to his mailbox because the porch felt unstable. He blamed his legs. But his daughter noticed the pattern. The weakness came hardest after his morning blood pressure pills and a hot shower. That matters. When pressure drops too far, the brain receives a short, frightening dip in blood flow. It feels like age. It is physiology. In SPRINT, 9,361 adults over 50 were studied. Intensive blood pressure treatment reduced major cardiovascular events, but serious low-pressure events, fainting, electrolyte problems, and acute kidney injury were higher in the intensive group. CDC steady fall prevention guidance also tells clinicians to ask about lightheadedness from lying or sitting to standing and to check postural blood pressure. Orthostatic hypotension is commonly defined as a systolic drop of at least 20 millimeters or a diastolic drop of at least 10 millimeters after standing. Plain meaning, one seated office reading is not enough for every senior. Ask this: what is my blood pressure sitting, standing after 1 minute, and standing after 3 minutes? Also, ask whether dehydration, a diuretic, hot weather, alcohol, or a new pain medicine changed the pattern. Do not stop the pill. Start the conversation. If this guidance is already helping your family, please subscribe and press like so this senior health community keeps growing. Every like helps another older adult receive useful information, and I am grateful when you share your experience in the comments. Side effect number 5 is the swelling many seniors can see every night. Nadine, 74, from Cleveland, changed shoes twice because her socks carved deep rings into her ankles. She thought her veins were simply old. Then her pharmacist noticed the swelling began after her amlodipine dose increased. Amlodipine relaxes small arteries. In some bodies, that widening raises pressure inside tiny leg capillaries, so fluid leaks into ankle tissue. Daily Med labeling for amlodipine reports edema as dose-related: 1.8% at 2.5 milligrams, 3% at 5 milligrams, 10.8% at 10 milligrams, and 0.6% with placebo. The same labeling reports fatigue at 4.5% versus 2.8% with placebo, and somnolence at 1.4% versus 0.6%. Common does not mean irrelevant. Women in the same labeling had a higher edema report than men: 14.6% versus 5.6% with amlodipine in one table, which tells us body differences and dose both matter. Ask yourself, did swelling begin after starting amlodipine, increasing the dose, adding another medicine, or sitting longer because you felt tired? The safe question is, could this be dose-related? And should we check my heart, kidneys, veins, and medication plan? Swelling is visible. Also notice whether swelling is one-sided, painful, sudden, or linked with shortness of breath, because that is not a simple sockmark story. The next side effect hides in the throat. Before we go deeper, tell me your age and the city you are watching from. Are you watching as a senior, a spouse, or a son or daughter caring for a parent? I am truly glad you are healthy and happy each day, and this channel is here to walk with you. Side effect number 4 is the dry cough that gets mislabeled as allergies. Cyrus, 69, from San Diego, slept in a recliner for 3 months because a dry tickle kept waking him. He bought cough syrup. He changed pillows. Nothing held. Then the timeline showed the cough started weeks after Lisinopril. Lisinopril is an ACE inhibitor. It lowers blood pressure by changing the renin-angiotensin system, but that pathway also affects bradykinin and airway irritation. Daily Med lists cough, headache, and dizziness as common adverse reactions in hypertension, with cough occurring 2.5% more often than placebo in clinical trials. An ACCP evidence-based review in CHEST reported ACE inhibitor cough across studies from 5 to 35% among treated patients. That range is wide, but the lesson is simple. A stubborn dry cough deserves a medication review, especially when it began after lisinopril. Ask, could lisinopril be contributing, and is another cause ruled out? Sometimes an ARB, such as Losartan, is discussed, but only your clinician should decide. Never stop lisinopril suddenly. Track the cough honestly, dry or wet, day or night, before or after the pill, with fever or without fever, and whether it disappears when your clinician changes the plan. A cough can disturb sleep, but the next side effect can stay silent until blood work speaks. If you are still listening and this is making sense, write the number 6 in the comments. If you do not like commenting, write 0. I use those small signals to know which topics help older adults most. Side effect number 3 is silent potassium or kidney function change. May, 76, from Seattle, felt fine until her routine lab call sounded urgent. Her potassium was high after a medication change and a switch to a salt substitute. She had no dramatic symptom. That is why this one matters. Losartan and lisinopril both act on the kidney hormone system that controls blood pressure and potassium. Daily Med warns that lisinopril requires periodic potassium monitoring, with higher risk in renal insufficiency, diabetes, potassium-sparing diuretics, potassium supplements, and potassium salt substitutes. It also reports hyperkalemia above 5.7 milliequivalents per liter in 2.2% of lisinopril-treated hypertension patients and 4.8% of heart failure patients. Losartan labeling tells clinicians to monitor renal function and potassium in susceptible patients and warns that NSAIDs in elderly, volume-depleted, or kidney-impaired patients can worsen renal function. Its labeling also describes the VA Nephron D trial. 1,448 people with type 2 diabetes and reduced kidney function had more hyperkalemia and acute kidney injury when Losartan and Lisinopril were combined without added kidney benefit. KDIGO guidance adds the practical timing. After starting or increasing an ACE inhibitor or ARB, blood pressure, serum creatinine, and serum potassium should be checked within 2 to 4 weeks, depending on kidney function and potassium level. Ask, when were my creatinine, eGFR, and potassium last checked? Bring every potassium pill, salt substitute, electrolyte powder, and anti-inflammatory pain pill to the visit. Do not guess. Review. If you have ever had a cough, swelling, dizziness, or a lab change that made you worried, share your story in a longer comment. I respect your story, and your experience can help another senior recognize a pattern before they feel alone. Side effect number 2 is fatigue, brain fog, and daytime sleepiness. Arthur, 81, from Omaha, told his grandson, "I am getting lazy." But he was not lazy. His brain fog appeared after a new evening dose, and his morning pressure sometimes sat much lower than his usual baseline. Low pressure for that person, dehydration, kidney changes, sedating medications, and electrolyte shifts can all turn into a tired brain. Amlodipine labeling reports fatigue and somnolence above placebo in controlled trials. Lisinopril labeling reports dizziness 3.5% more than placebo in hypertension trials, and in the Atlas heart failure trial, dizziness reached 19% in the high-dose group versus 12% in the low-dose group, while hypotension reached 11% versus 7%. This does not prove every nap is a side effect. It proves that timing and dose deserve respect. Older adults often blame character before chemistry. They call themselves weak before anyone checks whether the treatment plan is pushing too hard. Ask yourself, did the tiredness begin after a new pill, higher dose, different timing, illness, less water, or added sleep medicine? The safe bridge is a home log. Pressure before the dose, 2 hours after the dose, standing pressure, energy level, and symptoms. If the fog lifts on days when pressure is steadier, that pattern is valuable information for your clinician. If this section helped you think of someone, share this video with one older adult or caregiver, and turn on notifications because this channel keeps bringing useful doctor-led medical guidance for senior longevity and safer aging. Side effect number 1 is the controlled number trap. Elena, 84, from Albuquerque, had a clinic pressure that looked excellent, but she had stopped gardening because standing made her afraid. Her number was controlled, her life was shrinking. The best blood pressure number is not always the lowest number. It is the safest number for the body living with it. Sprint showed strong cardiovascular benefit from intensive treatment in selected adults, but it also showed more hypotension, syncope, electrolyte abnormalities, and acute kidney injury. European guidance for very old or frail patients emphasizes individualized care and suggests a systolic target around 130 to 140 if tolerated, not a blind race to the lowest reading. That phrase, if tolerated, is not a small footnote. It is the protection. Ask, does my target fit my age, fall history, kidney function, frailty, and symptoms? Ask again after hospitalization, weight loss, dehydration, a fall, or a new prescription. Good doctors welcome that question. A controlled number is not the same as a well-controlled person. Now see how these 6 problems stack. Dizziness reduces walking. Less walking worsens ankle swelling. Swelling makes people sit more. Poor sleep from cough worsens brain fog. Brain fog causes missed water or wrong timing. A salt substitute raises potassium risk. Then the office pressure still looks beautiful, so everyone calls it aging. A composite patient I will call Victor, 79, from Charlotte, had 3 small clues: evening ankle swelling, a dry cough, and morning weakness. Each clue looked minor alone. Together they told a medication story. His doctor checked standing pressure, creatinine, eGFR, and potassium, reviewed NSAID use, adjusted timing, and discussed the dose. The change was not a miracle, but Victor stopped feeling blamed by his own body. Use a 7-day pattern log. Write the pill time, sitting pressure, standing pressure, cough, ankle swelling, energy, water intake, salt substitute use, NSAID use, and falls or near falls. Use simple words: dizzy, swollen, dry cough, foggy, weak, steady. The goal is not a perfect diary. The goal is a pattern your doctor can use. And if you live alone, place the log beside your pill box, not across the room, because safety starts with making the right action easy. A small note written at the moment is often more accurate than a perfect memory 2 weeks later, especially when fatigue and dizziness are part of the problem. This is how a quiet symptom becomes useful medical evidence. Keep it calm and honest, not perfect today. Caregivers, do this gently. Seniors do not need interrogation. They need protection with dignity. Before the action plan, make sure you are subscribed and write your deep question for the doctor below. I promise to read each comment, and this senior health community is grateful for your experience and your serious medical questions. Safety warning. Get urgent medical care for fainting, chest pain, severe shortness of breath, one-sided weakness, confusion, new irregular heartbeat, swelling with breathlessness, very low pressure with weakness, or a potassium warning from your clinic. Never stop Amlodipine, Losartan, Lisinopril, or any blood pressure medicine without speaking to your clinician. Sudden changes are dangerous. The goal is review, not panic. Here's the practical plan. Tonight, do not change pills alone. Write when you took them and what symptoms appeared. Tomorrow morning, measure pressure sitting, then standing if your clinician has told you it is safe, and hold a counter or chair so you are not testing balance in a dangerous way. This week, call your doctor or pharmacist and ask for a medication review. Bring the bottles, not just the names, because dose, timing, duplicates, and over-the-counter medicines matter. For 2 weeks, track the pattern, not just the number. Ask whether potassium, creatinine, and eGFR are due, especially after a dose change. Long-term, review all over-the-counter pain pills, salt substitutes, supplements, and diuretics. Test one trigger: dose timing, dehydration, standing after heat, or evening swelling. Now correct the myth. More water, compression socks, cough syrup, or getting used to aging can miss the real issue. Home remedies have a place, but they should not replace standing blood pressure, labs, and a medication review. Do not chase symptoms separately when one pattern connects them. So here is your medication review checklist. Ask why you are on this specific medicine. Ask whether dizziness, swelling, cough, fatigue, brain fog, weakness, or standing symptoms fit your dose or combination. Ask for standing blood pressure. Ask when potassium, creatinine, and kidney function were checked. Ask whether your target still fits your body today. You are not overreacting. You are not being difficult. A blood pressure pill should protect your life without quietly stealing balance, clarity, energy, and confidence. This is not just aging. This is physiology, and physiology can be understood. In the next video, I want to serve you better. Tell me what topic you want next. Blood pressure timing, kidney labs, swollen legs, potassium, or medication interactions. Your comments guide this channel, and the best blood pressure plan is not just the one that lowers the number. It is the one that helps you live steady, clear, and safe.